Hi everyone, welcome back to Community Medicine, a channel I discuss matters health. Thank you for your continued support and kindly don't forget to subscribe, to like and to share this video. So today we are looking at early signs and symptoms of pregnancy. So you may be worried or you may be concerned on whether you're pregnant or not, and maybe it's too early to run a pregnancy test. So there are signs and symptoms that you need to look out for. The first sign and symptom is tender, swollen or painful breasts, and this could be due to hormonal changes, and this is actually a symptom that appears early in pregnancy. Something else is implantation bleeding or spotting. So once fertilization has taken place, that is in the fallopian tubes, the fertilized egg moves down into the uterus where implantation and growth is meant to take place. During implantation, a mother may experience spotting. So this spotting is actually light and it takes only a few days, and it's pinkish in color, as opposed to the menstrual bleeding, which is actually heavier and takes longer. However, if you experience bleeding for a long duration of time, you need to seek medical assistance, because could be that you're already pregnant and you're experiencing a miscarriage, or you just need to get checked. Something else is cramping. So one may experience cramps on the lower abdomen, and this actually happens due to expansion of the uterus, and this pain is actually similar to the period pain or dysmenorrhea. Yeah, so another thing is bloating. An increase of the progesterone hormone would interfere with the digestion process or would slow down digestion, and this would lead to constipation. Something else is frequent urination or frequent passage of urine. So once a mother gets pregnant, the body generates additional blood and fluids in order to sustain the growing fetus. So the kidneys will work extra hard in order to filter more volumes of the blood. So in turn, one would experience frequent passage of urine. Something else is nausea with or without vomiting. So some mothers may experience nausea with or without vomiting, and this is due to hormonal changes, and it would also be due to the release of the HCG hormone. So some mothers may actually not experience either nausea or vomiting, but some may experience severe nausea and vomiting, which could actually lead to admission. Yeah, another thing is lower backache. So an increase in the progesterone or of the progesterone hormone would cause the muscles and the ligaments around the pelvic area to relax, and this can lead to one experiencing some backache. So some mothers normally experience backache early in pregnancy, but others do experience backache in the second or third trimester. Something else is missed period, which is actually a very common sign. So once conception has taken place, and once the HCG hormone has been released, actually this HCG hormone allows the fetus to grow. So once the HCG hormone has been produced, you'll find that the hormone will interfere with ovulation and also menstruation for a duration of time to allow the growth of the fetus. Now, there are the reasons why one can miss their menses. For example, if one is using family planning like depot, like implants, or if one is experiencing hormonal imbalance, or even if one is stressed. So all these can also lead to one missing their periods. Something else is headache. So surge in hormones can cause the pregnant mother. And then something else is a dislike and a preference or a craving of certain foods, which is what we call or we refer to as food aversions and food cravings. So you may find this pregnant mother would actually crave for certain foods, and they would totally dislike certain foods which they use to take previously, and this is because of the hormonal changes. Another thing is fatigue. So an increase in the progesterone hormone. Actually, the progesterone hormone is responsible for maintaining a pregnancy. So an increase in the progesterone hormone would actually cause one to feel fatigued. And then having iron deficiency, anemia, would also present with fatigue. Now, there are other several signs and symptoms of pregnancy, but these are basically the early signs and symptoms of pregnancy. Now, you cannot confirm that you're pregnant unless you run a pregnancy test. So in case you experience a number of the signs and symptoms that we discussed, it's good to have to run a pregnancy test. You can go to a hospital. You can do a pregnancy test from home. I've done a video on how to do a pregnancy test from home. So this way you'll be able to be sure if you are pregnant or not. So stay healthy and don't forget to subscribe, to like, and to share this video. Bye bye.